आज दुपारी यवतमाळवाल्यांची
होती हा त्यामुळे संध्याकाळी आयनाचं नोटिफिकेशन आलं का तुम्हाला ते
ऑनलाईनच
ऑनलाईनच हा
हे अगोदरच माहित होतं का हे
हम्म.
बाकी कंट्रीज मध्ये तसंही बंद केलेलं आहे.
हा
म्हणजे इतकं स्ट्रिक आहे का आपल्याकडे चालू होतं पण ते
मोठाला दिसायला लागले ते. हॅलो, गोपी कृष्ण सर.
Hey, namaste, sir.
नमस्ते नमस्ते. So shall we try with screen sharing?
Yeah, definitely. Sure.
स्क्रीन शेअरचं ऑप्शन देते ना.
Okay.
डन ओके.
Yes.
ऑफ करके. Okay, sir. Just
Yeah.
close the window.
Yeah,
And
yeah.
7 o'clock sharp we'll start, sir.
Sure.
Thank you.
Hello, good evening, everybody. Dr. Shivanand sir, good evening.
Daga sir, good evening.
With your permission, just I will introduce NIMA Mutual Benefit Scheme with your member all, as I think you have some 2, 3, 5 minutes spare.
Yes, sir. Yes, please.
So, good evening, everybody, and that's a great that NIMA Dermatology Society is conducting online webinar regularly. And as you have seen, NIMA has started some super specialty societies as a proctology society, gynec society, OBGYN, dermatology society, pediatric society. In the same way, NIMA has one more branch, that is NIMA Mutual Benefit Scheme. And I think most of the you people may know about this scheme. This scheme, NIMA runs for the benefit of the members and their family. You have to be a member of a NIMA Mutual Benefit Scheme, and if something goes wrong with you, your nominee or your family members get almost 1,15,000 rupees help from the NIMA. To detail regarding this scheme, you have to contact with your local branch member, and if you get registered under this scheme, you can get few benefits like just I have told that something happen wrongs with you, your family get a help of 1,15,000. At the same time, if you come under some crisis of medical emergency, at the time also NIMA give you a help of 10,000 if your medical bill is more than 20,000. In your total lifespan, you can take a benefit for 2 times in a gap of 5 years. So this is a very wonderful and productive scheme run by our NIMA central body. And I am a treasurer for this scheme. You can contact me or you can contact with any of your local NIMA member and get aware of this scheme. You have to just fill one form. Some membership fees is there. You according to your age, you can submit that membership fees, and you can have a NIMA member of NIMA Mutual Benefit Scheme. And other than this, if some members of your society doesn't know about the NIMA, I will just take opportunity to brief regarding the NIMA. In this 2023, NIMA is completing 75 years. NIMA is celebrating Amrut Mahotsav, and NIMA started in 4th April 1948. with 21 members only. Now NIMA has above 75,000 member all over India. NIMA started with one branch. Now NIMA has a 1200 branch all over India. In many states, due to NIMA only, we people got a opportunity to practice in integrated means allopathy and Ayurveda. In presently, many states are there. They doesn't have that liberty to practice integrated. NIMA is fighting in that state also. In Maharashtra, fortunately, we have that opportunity. We can practice allopathy at the same time Ayurveda also. So this is about NIMA. I will request and appeal to all your NIMA members or all your society members. Those who are not a member of NIMA, they get membership of NIMA local branch. And those your colleagues which are not a member of NIMA, I will request and appeal all the members to please encourage them to get a member of NIMA, because see, whenever we have to put our any demands to the government or to the related field, the number of members plays a role there. How much members you have? When a dermatology society will come with some demand that we want these things to be done by our society, and government doesn't allow, the number of your society members will definitely put a value there, to definitely put a weight there. And I have seen many decisions which government has taken which are not favor in our side. After appealing or after our resolution, after our request to the government with such a huge majority, government has changed their rules or their regulations. So again, I will request all the members to get a membership of NIMA and come forward to work for NIMA.
Yes.
Thank
Sir,
you. Thank you, Shivan.
sir, can you just tell the fees of becoming the MSB member?
See, up to the age of 45, 1500 is a initial admission fees for a NIMA member to get a membership of MBS, 1500, 1500. And every year, it is almost 200, 2300 rupees every year. If you don't want to submit or deposit fees every year, one time you can pay. One time fees is only 20,000. If you pay one time 20,000, you don't have to pay anything in your life, and you will get a membership, life membership of MBS. Now presently we are giving 1,15,000. But see, when I have become a member of NIMA Mutual Benefit Scheme, almost I think 8 years back, that time it was a fees was 13,000 only, and NIMA used to give 60,000 only to the deceased person. It has increased now to 1,15,000. May after in a coming 10 years or 5 7 years, that the amount paternity amount will be increased to almost 5 lakh 7 lakh also. So by submitting only 20,000, you will get a benefit of 5 lakh to your family member. It's a, I have calculated in all the sense. If you
Yeah.
compare it with the term policy also, you will find that this scheme is more beneficial for you.
Yes, sir. Thank you, sir. Thank you very much. And I request all the Dermatology Society members to become a member of NIMA MSB. So we'll start from our society. So we assure you, Daga sir, that all members of Dermatology Society will become the MSB members.
Chalo, thank you and best luck to your society.
Thank you,
Great
sir.
work. Thank
Thank you.
you.
Thank you. Thank you very much. Thank you very much. Let's start.
ओके
Yes.
सर 1 मिनट बाकी है
Okay. We'll wait.
या So, can I start, sir?
Yes, sir, you can start.
A very good evening, Shubh Sandhya, Sat Sri Akal, Namaste to all the dignitaries of NIMA, our honorable speaker, Dermatology Society members, guest members, and most important, our audience doctors. I, Dr. Surjit Kaur Bawa, welcome you all to this Derma Veda series. It's a privilege and an honor to be hosting this wonderful knowledge imparting session of the Derma Veda by the NIMA Dermatology Society. Now, what is NIMA? National Integrated Medical Association is the largest organization representing institutionally qualified ISM graduates. NIMA was established in Delhi on the 13th of April 1948, that is exactly 77 years ago, to achieve the honor and dignity and to uphold the interest of our integrated medical practitioners, to promote them and their practices, their education. NIMA has been working tirelessly to protect the rights of ISM graduates since its inception. Another important aim of NIMA is to achieve the status for integrated medicine as the national medicine of India by consolidating public opinion in favor of integrated medicine. With an encompassing vision, NIMA has set its own pace for growth and progress, which could set it scale more pristine heights in the future. For the first time, NIMA has formed specialized societies, namely NIMA Obgyn Society, that is NIMA Obstetrics and Gynecology Society, and ours, NIMA Dermatology Society. We at Dermatology Society of NIMA are honored to be a part of this unique team headed by our very favorite of all, Dr. Shivanandji Patil, as our president, who has been held us together with his great leadership qualities and visionary activities. NIMA Dermatology Society holds scientific webinars, Derma Veda series, and competitions for Ayurveda doctors. Whenever we begin any good work, we always invoke gods for the success of the work. Let us begin our session with Dhanvantri Stavan. May I now invite Dr. Spurti for her melodious Dhanvantri Stavan. Dr. Spurti.
Thank you so much, ma'am. So it is said that always we begin with a Dhanvantari Stavana, and even that I follow in my clinic also. So I request everyone to join with me for the Dhanvantari Stavana. Om Namami Dhanvantarim
Mantarim
Adidevam
Adidevam Sura
Surasure Vandita Padapadmam Loke Jara Bhayam Mrityunasham दातारमीशं विविधौषधीनां धन्वन्तरिं रमानाथं सर्वरोगनिवारकम् आयुर्वेदप्रवर्तारं वन्दे पीयूषदायकम् सर्वे जनाः सुखिनो भवन्तु ॐ Shanti, Shanti. Thank you. Thank you so much for the opportunity.
That was really divine. May I now request our respected president, Dr. Shivanandji Patil sir, to enlighten us with his vision for the Dermatology Society. Dr. Shivanand Patil sir.
So, good evening to all. In the beginning, I welcome you all for today's webinar. NIMA Dermatology Society is continuously organizing several activities to update the knowledge of BMS graduates. We conducted several webinars where we invited the guest speakers from Ayurveda faculty as well as from the modern faculty. And we tried to cover almost all the areas which are required in our successful dermatology practice. Even we conducted the competitions for undergraduate students, the competition for postgraduate students to develop the research oriented approach. Even on the Women's Day, we conducted competitions like beautiful skin and hair, just to value the female. Likewise, again, we are continuing the webinar series. Next, we are planning for again some recipe competitions, which Dr. Ruchira will be telling you in detail in later time. And our main aim is to conduct the international seminar cum workshop. So we are vigorously working to update the knowledge in dermatology. And the Dermatology Society membership is ongoing. The eligibility criteria are any BAMS graduates completed the online or offline courses in dermatology, cosmetology, and aesthetic medicines. All doctors are eligible to become the member of NIMA-Dermatology Society. Along with that, the membership fees are the doctor who are already the member of NIMA, they have to pay 5,000 rupees as a lifetime membership fees. And non-NIMA members, they have to pay 7,000 rupees as a lifetime membership fees. And a very important thing is NIMA is having a very strong legal team which can guide us in our problems during dermatology practice. So I request all doctors who are in dermatology practice, cosmetology, and aesthetic medicines to join NIMA Dermatology Society. Thank you very much.
It's a pleasure and an honor to welcome our delegates and the guest NIMA members. I welcome NIMA Central Immediate Past President, Dr. Vinayak Temburnekar sir, our President, Dr. Ashutosh Kulkarni sir, our Secretary General, Dr. Uma Shankar S. Pandey sir, our Treasurer, Dr. Shantilal Sharma sir. I also welcome our Maharashtra State President, Dr. Tushar Suryavanshi sir, Secretary, Dr. Mohan Yande sir, and our Treasurer, Dr. Sopan Kharche sir. May I now request Dr. Ashutosh Kulkarni sir, our President, to enlighten us with his wisdom.
So I think sir is not there right now.
Okay.
You can continue.
Yeah, thank you, Dr. Shivanand Patil sir, for your wonderful vision for the dermatology and the cosmetology doctors. May I now request and invite Dr. Rupali Uttarwar to introduce our esteemed speaker, Dr. M. Gopikrishna.
Thank you, Dr. Surjit ma'am. This is Dr. Rupali Uttarwar, Assistant Secretary, NIMA Dermatology Society of India. It's my privilege to introduce a great Rasavaidya, truly a milestone in Rasaushadhi practice, a renowned personality that is none other than Dr. M. Gopikrishna sir. Dr. M. Gopikrishna sir is Rasavaidya practicing at Srinivasa Clinic, Bellary, Karnataka. Also, he is the co-founder and chairman of IIAR, that is Indian Institute of Ayurveda and Rasashastra. He has done his MD Rasashastra from SDM College of Ayurveda, Udupi. He is also a student of a national level personality professor, Dr. Siddhinandan Mishra, who is a president awardee. Sir is experienced in all types of Ayurvedic preparations, also in modern pharmaceutics and metallurgy with practical approach. He is a successful clinical as well as academic person with multidimensional views regarding theory and practical approaches in Ayurvedic science with credentials of good successful practice in managing complicated cases. Sir has been awarded with IASTAM Award as Vaidya Chandra Prakash Memorial Award for contribution in Rasashastra, Astha Vaidya Kaibalya 2023 Award by Astha Foundation, and many more awards. He has translated many texts and has more than 20 publications in peer-reviewed journals. Also, Sir has conducted geological field survey for exploring Ayurveda drugs. Sir has delivered more than 100 guest sorry, Sir has delivered more than 1,000 guest lectures as chief speaker. In brief, if I would enlist all his work in various fields, surely I will take over the session, but I won't do so because all are eagerly waiting to listen you, sir. So I welcome you, Dr. Gopi Krishna, sir. Now the session is all yours. Thank you.
Thank you.
Thank you, sir.
Is it fine? Audible?
Yes, sir. Yes, sir. Yes, sir. Go ahead.
Thank you. Thank you. So, good evening to one and all. It's a really pleasure to meet all of you on this dais and come more in front of you to discuss the topics on the common skin complaints. Might be the dermatology related to the clinical practices, and my specialization is primarily with rasaushadis. So, what specific rasaushadis we usually use in common skin complaints which we come across in our routine clinical practice. This is what I'm going to discuss with you people in the next 45 minutes or 60 minutes. Let us rush through the slides because dermatology is a very, very big chapter to discuss with so many clinical conditions. So we'll try to see how best we can justify with the topic and try to see what best we can do to this particular topic in related to the rasaushadis on today's presentation. So, salutations to the God for giving this divine science of Rasa Shastra, for dealing with the most complicated, dreaded, and quite a challenging cases like that of the dermatology, very specifically to speak about. And we need to treat the patient accordingly. This is one such area where it's a really good platter for the Ayurvedic community to treat with the conditions like that of the skin pathologies. Because very commonly nowadays, we do come across many of the skin complaints in our routine clinical practice, the first thing. The second thing is very specific. People are very, very much aware about the cosmetic issues. People are very particular, like even it's a small sort of a mole or discoloration or tanning, any complaint as such, as a cosmetic issue or a therapeutic guidelines, people are really very much aware to treat with the clinical conditions as early as possible and come out of it. Because even a small mole is a sort of a social stigma for the present generation. Let us try to see how best we can justify on this particular topic today. So before I start, I would like to acknowledge the whole team of NIMA, Dermatological Society, especially to Shivanand Patil sir, for inviting me on this particular dais and asking me to speak on the dermatological issues and related to the rasaushadis. Because the chapter is too big, I'm not speaking much about the cosmetic issues related to that of dermatology today. I'll be speaking more about the therapeutics, the disorders related to the skin. Possibly you take it as kushta or either of the clinical conditions and try to address them on the clinical grounds. When you have a patient right in front of you, what is that? At the first line of treatment, we need to think about. So this is what I'm trying to plan up with my presentation. I'll not go into the individual of the skin pathogenesis, samprapti and all, because I could really learn from this particular NIMA society that everyone here are already doctors or who is related to BMS. It's not something like people who are other than Ayurvedic people. So I'll not speak about what are the types of Kushta, what did Charaka speak about it, Sushruta speak about it, what are the types of it, everything. Possibly everyone know about it, or you can definitely refer it from the textbook. I'll be focusing more on the therapeutics or the treatment aspect of the skin conditions instead. You can refer with the pathogenesis and other details from the textbook for more interactions with this particular part of Kushta Chikitsa. The very first step which I would like to say is about the Vyadhi Pratyanikam. Possibly we take it as Snehanam, Shodhanam and Raktamokshanam. Mukhya Aushadhis, very specific Gandhakam. Gandhaka, Nimba, Katuka Pitta Tailam, Bakuchi, Haratalam, Kadiram. There are many things. I'll give lots of details about what all the drugs we can use it in Kushta Chikitsa. In case if it is related to the Maha Kushtam, the category where specifically it is to the Vata or Vataja Mahakushtam, where you take it as a Kapalam and all. Common prescriptions which we try to give in our clinical practice is Swayambhuva Gugulu with Grutha and Madhu as an Anupanam. If it is Pittaja or Audumbara Kushtam, we take it as a Tala Basma Mishrana with Madhu and Grutha as a combination. If it is Kafaja Kushta or Kafaja Mahakushtam, like Mandala, what you take it as, Arogyavardhini, Karavera Twakka Churnam with Madhu and Grutha could be the common prescriptions which we use in our clinical practice. Vata Pittaja conditions like Rishajivha, where we commonly come across with Sarvanga Sundaravati and try to use it in combination with the Katuka Pitta Tailam with Grutha and Sharkar as an Anupan. Kapha Pittaja, as you can see in case of Pundarika or Vata Kafaja as Sidma or Tridoshaja as Kakanam, we go with Yatha Dosha Chikitsa. Chandamaruthalepam is a very promising drug in most of the Kushta Chikitsas. I will say when you refer many of the textbooks, either it is from the Chikitsa Sampradaya, Dravyaguna, Rasa Shastra or Vaishajya Kalpana, you can enumerate thousands and thousands of drugs which are related to the Kushta Chikitsa. Basically, I will say it is very easy to treat the conditions based on the doshik levels in Kushta Chikitsa. Based on that, you will have some prescriptions for Vataja type, Pittaja type and Kafaja types. And when we speak about these three categories of doshik levels, Vataja conditions where we have, these could be the common prescriptions which we have shared. Only thing is if it is Dvandvaja, like Vata Kafaja conditions, there are so many clinical conditions where we have Vata and Kafaja involvements. Very specifically, we try to administer to those patients with Malla or what you call it as Gauri Pashana or Tamra. Tamra is another choice. If it is a chronicity of the illness, say for example, the patient is suffering from Vata Kafaja clinical conditions since years, my choice is always Tamra. Tamra is a very good Vatahara, Kafahara and also Dirgha Kalina Vyadhis. So chronicity of the Kushta, Vata and Kapha origin, specifically we go with the Tamra as a prescription. If it is recent onset, then we go with Haratala like preparations or Gauri Pashana or Manashila preparations or arsenic based. Then they are said to be very predominant in acting in these clinical conditions. Only one thing you need to keep in mind is if at all, if your patient is on Pitta, either Prakrutita or Vikrutita, try to avoid or minimize using Tamra and Haratala yogas. Because Tamra and Haratala yogas are Ugra Rupa, and you need to instead prescribe the person suffering from Pittaja Kushta Vyadhis or any of the skin pathologies with the drugs combinations like a Pravala, Godanti, Madhueshti, like combinations. My choices always are in Potali forms. So I try to go with Tamra Garbha Potali, I go with Shila Garbha Potali, Malla Garbha. In case if you people are unable to procure a proper Potali preparations with you, yes, Basma is a substitute to it. But the best form is always the Potali Kalpanas. So according to that, when I speak Tamra, you need to imagine yourself like it should be Tamra Garbha Potali. In case if I say about the Pravala, it is a Pravala Garbha Potali. You are unable to procure it, then Pravala Pishti could be the next choice. Similarly, for Kapha and Pittaja conditions, as you can see here, Chandamarutam, which I have claimed in Kapha Pittaja or Vata Kafaja or Tridoshaja conditions, normally, if not to the doshik levels, very specific to the patients suffering like the eczemas, psoriasis, or any of such conditions, so Chandamarutha is a drug of choice. If you just go for application of Chandamarutam with Navanitam butter, I'll say the skin becomes so good, possibly within 3 days or 1 week, you find as if your dirty cloths is being washed with a very good detergent. It becomes so clear. The skin becomes so clear by using Chandamaruta Lepam. Only thing is you should be very, very precautious in using Chandamarutam. Don't use any of the metallic components to mix the drug. You want to take Chandamarutam, you need to take 10 grams of the powder Chandamarutam. It's from the reference Vaidyoga Ratnakaram. And to that, you need to mix 100 grams of Navanitam. Mix it in a porcelain kalva or a glassware. Don't use metal spoons like stainless steel or iron or anything like that. You should always use it only with the porcelain or glasswares, or even plastic will do if you are okay with it. And ask the patient to apply this particular paste all over the affected area or all over the body. As you can see in case of psoriasis, it's all over the body many times. What you might call it as a Matsya Shakala or whatever the conditions is about. You need to go for those applications accordingly and just leave it off for some time. Might be for 4 to 6 hours, and later on you can definitely use it to clean it with a Bengal gram powder or any of the herbal powders to see that all this Navanitam is washed off. Very short period, you find all the lesions will disappear. This is something like a miraculous treatment, if at all you have such clinical pathologies. Anyway, the next comes is about the Kshudra Kushtam. So in Kshudra Kushtam, what happens is it's specifically related in case if it is the Kaphaja conditions, as you can see in case of Vicharchika. Arogyavardhini with Kadirarishta as an Anupanam. In case if it is Vata Kaphaja or Vaipadika, then it is Swayambhuva Gugulu with Kadirarishta as an Anupanam. You can definitely have your own prescriptions. This is just a guidelines to say like what we are using here. The next thing which is very commonly to be explained is Kapha Pittaja conditions. As you can see in case of Dadru, Charmadala or Pama or Kachu or Sataru like clinical conditions. Arogya Mishrana with Manjishthadik Vatam. Nimba Gandhaka Churnam with Grita and Sharkar as an Anupanam. Gandhaka Dhruti with Kshiram. These are the common prescriptions which we use here. In case if it is Vata Pittaja conditions, as you can see in case of Ekakushta or Charmakitiva, in those clinical conditions, Gandhaka Rasayana with Ghrutam or Sharkara Anupanam is a great choice. Most of the clinical conditions related to Tridoshaja conditions or specifically to the Vata Pittaja, Gandhaka is a promising drug. Dump the patient with Gandhaka. I will say you can ask him to apply it on the body, you can ask him to consume it orally. We try to give even up to 6 grams per day, Gandhaka Churna or Gandhaka Rasayana. Gandhaka Rasayana is easily available to every one of us. So you can give up to 6 grams per day in case if the clinical condition is very extensive, provided you do a proper Shodhana and try to use it in your clinical conditions. Shvitra, we will repeat the slide again and again because we'll come across these clinical conditions eventually. It's not like this slide is over, I could not take up the protocol. You have this to be repeated again and again. So we'll come across them. Normally in Shvitra, it's a very, very complicated thing because sometimes the patient responds wonderfully in a short period. Sometimes the patient is absolutely reluctant in addressing. Then he never gets treated even though you treat him for months and years together. So this usually happens in case if you're trying with treating the condition in case of Shvitra like clinical conditions. So normally our prescriptions in Shvitra are Hemagarbha and Tamragarbha Pottalis with Indukanta Kashayas and Anupanam. Tankana Lepam or Jayapala Lepam. In case if you are using Jayapala Lepam, be very cautious because it will cause blisters, but still it is an excellent remedy for Shvitra. You need to counsel the patient because he will develop lots of eruptions on the affected area, but you can counteract it by simple application of coconut oil, or you can ask him to take orally with Godanti or Pravala like preparations to palliate. Arogyavardhini with Grita and Sharkara as an Anupanam. Karavira Twakchurnam with Grita and Sharkara as an Anupanam. Bakuchi Bija Churnam with Kadira Amalaki Kashayam as an Anupanam. Sarvanga Sundarivati with Grita as an Anupanam or few of the prescriptions which we would like to recommend in case of Shvitra conditions. There are, of course, as I said, many conditions where you can address the issues. We'll come across them again in detail in the eventual slides. Panchakarmopachara, of course, definitely you can go with Vamanam, with Madanaphala, Virechana, with Virechana Kashayam. Rakta Mokshanam with Jalauka, or either of the conditions, what you find it's appropriate for a particular patient right in front of you. Baheshamanopacharam, Snehanam, where you go with Katukapitta Tailam or Jyotishmati Tailam, Nimba Tailam, Arka Tailam. These are few of the choices. Lepa like a Haratala Mishrana, Tankana Mishrama, Jasada Pushpam, Chandana Churnam, Snigdha Lepam like Sudarshana Lepam, Shatadhauta Gritam, Shvitra Lepam like Bakuchi Churna Lepam, Shvitra Hara Lepam, and Apatyas like Amla, Lavana, Katu, Annam, Dadi, Dugdam, Guru. This is again Rogochitam. You can definitely go as per the patient's clinical presentation, his doshik prakriti, and try to use it. Visarpa Chikitsa. This is also very tackling sometimes, but most of the times the patient responds very well for Pitta Hara Chikitsa. Vata Pitta Hara Chikitsa, most of the times. Vyadhi Pratyanikam, Rakta Mokshanam and Virechanam, Mukhya Oshadhi, Dravanti, Gandhaka and Gairika. Gairika is used as external application in all the Visarpa cases here. Abhyantara Oshadhis, Vataja conditions, Vata Pittaja, Vataja and Vata Pittaja conditions, Guduchyadi Kwatam, Pittaja conditions or Kapha Pittaja conditions, Bhunimbhadi Kwatam, or Gandhaka Rasayanam with Kshiram. Kaphaja conditions or Vata Kaphaja conditions, Nimbhadi Kwatam, Sannipataja conditions or Kshataja conditions, which is considered as Asadhya. So in these conditions, normally what we do is Gandhaka is mixed with Karpuram and it is being applied on the affected area. If the patient is very sensitive in respect to herpes or in conditions like what you might take it as Visarpa, you can go with Gairika Lepam on the external area. And if at all you can mix with small quantities of Karpuram, then it is a great choice. Panchakarmopacharas like Vamana, Virechana, Rakta Mokshana. Lepa Kalpanas, like any of these things can be used. They're directly from the textbook. Please go through them. Other prescriptions which are very commonly given in case of Kushta Chikitsa or Pravala Garbha Potali with Panchavalkala as an Anupanam is an excellent choice in case if you are able to go with the Pittaja conditions. Most of the Kushta Chikitsas, I find an excellent response with Pravala Yogas because Pravala is one which acts on Rasa and Raktavashrotas and Pittahara. So it is an excellent choice. Patient is having Daha, patient is having Kandu, patient is having Santapa, patient is having some discharges, oozing from the ulcers or skin lesions, Rasan Raktava Shroto Vikhara, primely Kushta, then we take Pravala as a prime choice. We go up to 12 to 18 grams of Pravala Garbha Potali per month. So this is the dosage what we usually prescribe in case of Kushta conditions. Loha Garbha Potali with Manjishtadi Anupanam is also a great choice because in case if you are finding the clinical parameters or the Dushti Lakshanas related to the Rasa and Raktava Shrotas very specifically, then Loha Garbha Potali or Loha Basma is a great choice. If you find it is very deep rooted and if it is not much related to the Pittaja conditions, then we try to go with Talakeshwara Rasa or Rasamanikya lake preparations, which is really good. Hingaluya Manikya Rasa is also a great choice in these conditions. Tala Sindura is also a great choice. Only thing is you need to ascertain if it is a Haratala Yoga, don't use it in Pittaja conditions. If at all it is mandate for you to use it, then mix it along with Godanti or Pravala or Madheshti like preparations and try to see that the Pitta is not much further vitiated in the patient. Because Haratala preparations are really very ugra and you need to balance your patient in case if it is mandated to use Haratala preparations. This is Loha Garbha Potali. Very specifically, we try to use in these clinical parameters like Rasa and Raktava Shroto Vikaras, including the Kushtavyadi. Pravala Garbha Potali is also a great choice. This is also can be used in Bala, Sukumara, Stri, and also in Vruddhavastha. Very commonly used in Rasa and Raktava Shrotas and Pitta Vikaras. In case if it is Rasa Garbha Potali, where you need the Yogavahi, means I have a herbal component, might be I would like to use Shirisha. Shirisha is a very good Vishagana Dravya which is used in allergic conditions. You have allergic rashes. you find many of the immunoglobulin related issues in the skin conditions. In all those conditions where we give Vishahara Chikitsa, like what very popularly we give some of the Agadas, which is explained in Agada Tantra. So any of those things can be given as an anupanam to Rasagarbha Pottali, then it's a great choice because it enhances the biological availability of the herbal component which you would like to observe in the patient's body. So that's a great choice of using Rasagarbha Pottali. Hemagarbha Pottali is a promising drug in case if it's a deep-rooted illness or in case if the person is suffering from Bahudoshavastha, chronicity of the illness, autoimmune pathologies, metabolic disorders, or any such clinical conditions. Most commonly, when you speak about Kushta, very common clinical condition comes right in front of us is the psoriatic conditions. Psoriasis is an autoimmune condition, and among that, Hemagarbha Pottali is a drug of choice because here, by giving Hemagarbha Pottali, we are not addressing any of the issues related to that of the skin pathology. Instead, we are addressing the autoimmune repair, which is supposed to happen in the patient. Because normally what happens is in psoriasis patient, we try to give them with some combination of drugs. Patient is out of the illness. We find it has been cured. No, absolutely no. It has relapsing, waxing and waning of the disorders. You find this Hemagarbha Pottali to arrest this clinical pathology. You need to address the immunity of the patient, not the skin condition there. So you have a similar presentations of autoimmune pathologies, then you need to give Hemagarbha. Talagarbha, as I already spoken about, it is very specific to be given in Vata and Kaphaja conditions and never in Pittaja conditions. Similarly is Shilagarbha and also Mallagarbha. Tamragarbha, Vata and Kaphaja conditions and chronicity of the illness, we try to go with Tamragarbha. Rasadravyas, very common references which we commonly use in most of these clinical conditions. Like Dadruhara, Gandhaka is being explained by the textbook. This is all how I present like the drug textbook, chapter number and shloka number. Gandhaka is referred as Rasaratna Samuchay, 3rd chapter, 18th shloka. So similarly is the whole protocol. Most of these Kushta patients do have Daha. They say, sir, I'm having burning sensation all over my body. Like as you have in case of Pemphigus vulgaris. Then you need to give them with the Daha Prashamana. So these are the references which the Rasa textbook speaks about. Like Gairika, Rajata, Mukta Shukti, Pusharaga, Chandakanta, Spatikamani, Dugdapashana, Katika, Kandunashana, because most of these patients do have itching. So Kandunasha, where we give Makshika, Karpara, Gandhaka, Gairika, Kasisa, Spatika, Haratala, Manashila, Vruddhara Shringa, Dattura, and Gandhaka. So you can refer all these things later on from the textbook because this is a direct reference from textbook. It's not from my pocket. Pamahara, Vruddhara Shringa is indicated. Shvitrahara, Tutta, Kasisa, Spatika is indicated. Navasadar is also indicated here. Tarunya Pidakahara, Shanka and Katika are being indicated. Tvaka Dosha Shamana, Shilajatu, Tutta, Mruddhara Shringa and Gomeda. Udarda or Shita Pitta, Gairika is being indicated by Ayurveda Prakasha. Similarly, Varnya set of drugs, because always we definitely need this Varnya component to be observed in the we try to go with addressing with Abraka, Vaikranta, Aratala, Manashila like preparations. Varnya, you have a set of drugs in Rasa Shastra which can be used in your patients. Vicharchika, Haratala, Vaipadika, Haratala, Visarpahara, Gandhaka, Spatika, Haratala, and Kantaloham can be indicated. Vispotahara, as you can see, bulles. So wherever you have this watery discharges or bullous like presentation or bulle presentations, there we give Haratala. And in case if it is inevitable, we have to add Pravala or Godunti to it and administer to the patient. Vranas, where you have ulcerations on the skin, we go with Spatika, Savirajana, Vruddhara Shringa, and Tamra. Vranagna, repeatedly patient is having ulcerations on the body. In Kushta Chikitsa, these are all the various prescriptions which can be given to the patient. These are the common skin complaints when you come to see among the contemporary sciences where the patient is already come with a diagnosis being tagged by himself or from any of the dermatologist. He comes to you with the clinical conditions. So this is again what are the various clinical conditions wherein the skin lesions might look upon in various parameters. Like you have a macule, you have papule, nodule, vesicle, pustule, bullae, wheals, scaling, scab, infiltrations, lichenification, pigmentation, ulcerations, and scarring. So every one of us know about it, but we'll try to see what could be the treatment protocols in these clinical conditions. The very first one is about the macules, where you have the spots with abnormal change of the color at the skin level. You don't have elevated spots. You have these clinical conditions in many of the disorders. It's not alone in only one or two disorders. In many of the clinical conditions, you find this macular-like clinical presentations where the lesion is at a skin level. So in these conditions, at a gross level, you need to pinpoint the disease and try to go with it. But as a preliminary set, as I said, what would be my first line of management? Blindly, most of the times when I see macules in the patient's body, my choice goes towards a Triphala Guguluan Gandhaka Rasayana. Most of the times. Again, depending on the other parameters, you can go on changing your prescriptions and try to go with it. But still, in case if the patient comes to you with a papule, where you have a solid projections above the skin level, the lesions are above the skin level here. So in these clinical conditions where you have the papule-like clinical presentations, my choice is Kaishora Gugulu with Gandhaka Rasayana. So there is a small alterations here. So when it is a macule, it is Triphala Gugulu with Gandhaka Rasayana. If it is a papule, then we try to go with a Kaishora Gugulu with Gandhaka Rasayana. Nodule-like clinical presentation where you have a large papules like nodular conditions. Possibly you can see it in some chronicity of the rheumatoid arthritis or any of the skin conditions where you have the nodules being commonly seen. Here in all these conditions, the Tamra and Haratala plays a major role in addressing many of the issues. You need to diagnose the patient and try to prescribe the drug. No choice in that. But still, as I said, what is my preliminary drug of choice when I have a patient suffering from a nodule-like clinical pathology? Then I have Tamra with Haratala. Vesicle-like a clinical presentation with a papule containing clear fluids within it. So this is also very commonly seen. And here in these clinical conditions, Gandhaka is a drug of choice. Sulfur is a great choice to the people where you have skin ailments. Most of the time, sir, I'm worried if at all the patient is having some allergy towards sulfur drugs, or if the patient is not happy in taking Gandhaka preparations. The next choice is Pravala and Bodanti, Gairika. These are the choices for me. You can go for external application and as well as oral administration of these drugs, wherein the patient will excellently respond. The next condition is about the pustules, which are vesicles containing the pus. Always in these clinical conditions, wherever you have the pustules, try to choose, if at all, you can plan up with the Haratala preparations. In case if you are able to do, that's a great choice. I'll say in most of these pustule conditions, sir, I don't have really Haratala Basma in my clinic because it's not a routine prescription among the common practitioners to go with the Haratala preparations. Then I try to go with, there is a ready combination of the drug available called as a Sheetamshuras in the market. So you can definitely go with the Sheetamshuras in case if it is a pustules, because one of the common composition in that is Haratala. It's a reference from Basavarajiam. It's a classical reference from Basavarajiam, Sheetamshurasa. It's a great choice in case if the patient is suffering from pustules. And in case if the person is, in case if you don't have the Sheetamshuras right in front of you, then you can definitely go with the other choices like the Tala Sinduram or Tala Garbhakotali, Malla Garbhakotali or Malla Sinduram. And in case if the person is suffering from Pittaja associated condition, accompanied along with Gairika or Bodanti. Bullae, like formations, like large vesicles containing the clear fluid. The combination is still the same. The Tamra and Haratala yogas are commonly used here. My choices most of the times to be ready at hand when I have a patient suffering with Bullae. Clinical presentations is about the Tamra Garbhakotali and Tala Garbhakotali. The wheel, these are most big headaches because they become very chronic. Flat elevated portions of the skin, paler than the periphery, which may be erythematous. Most of these times, they do respond for the external treatments like Gandhaka Lepam. Normally, we go with Gandha Karpuram. Gandhaka and Karpura are being mixed and it is being applied locally. In case if you don't have much of the itching, where you don't have the abrasions because of the nail of the patient being rubbed over it, then you can definitely go with the Karpura Thailam on this particular affected area, or Gandhaka Lepam. Even orally, we try to go with Gandhaka Lepam. Pravala Panchamrita or Pravala Garbha Potali is a great choice in these clinical conditions. Sometimes they do have extensive burning sensation. So Pravala Garbha Potali along with Pravala Panchamrita, Godanti like preparations are mandated to be given in case of wheel clinical presentations. Scaling, where you have the desquamation and the loss of epidermal cell on the dry lesions, very commonly seen in case of psoriatic lesions. Very, very common. I'm not saying like it's not available in another clinical conditions. Definitely it is seen, but still it is very high in case of psoriasis-like clinical presentations. We do have a combination called as a Ananda Thailam or Ananda Ghritam. It's a combination made up of Thaila and Ghritha preparation made with the Jasada Basma and Gairika. So Jasada and Gairika are being mixed as the Kalka Dravya, and we try to use coconut oil or the Ghritha respectively and try to prepare a Thaila preparation out of it. Filter it just like other Pakalakshanas, whatever you see with regular Thaila and Ghritha preparations, and try to use it in the patients of these kinds with external application. You need to address the Samprapti, no doubt in that. You need to assess what is the clinical pathology. In case if it is psoriasis, we try to go with the psoriatic clinical parameters and try to treat the patient. That is in the eventual slides. This is based on the skin lesions. The scab or the crust-like formations, where you have the desquamation on the moist lesions like the vesicles or pustules. Even these conditions are very commonly seen, and when you have this crust formation or a scab formation, you are supposed to give to the patient with Tamragarbha. Adamant or hardened tissue or sclerotic changes or desquamation or any of such parameters you find on the skin, then you need to give Tamra to the patient. This could be a great choice. Whenever you give, this is addressing to the skin lesions, not on the pathology. Infiltrations can be felt with fingers. As you can see, you find, yes, these lesions are quite deep. This is called as infiltrations, which can be felt with fingers, where it goes deeper and deeper. And when you have this particular clinical pathologies, Haratala preparations with Gandhaka and Pravala. One more thing very important in all infiltrations pathology, use of Loha Basma or Loha Garbha Potali is a great choice. And you need to add up Loha, Pravala, Gandhaka and Haratala. All these drugs to be mixed up. Might be you can give it as a separate combinations mixed up in the form of a mixture, or if at all you have any of the formulations of your choice where you have these drugs to be used in it, yes, definitely it can be given in case of infiltration pathologies. Lichenification is also very commonly seen in many of the clinical conditions. Sometimes even in tinea, sometimes in eczema, sometimes in psoriasis, many things. It's a leathery thickening of the skin, resulting of a compulsive itching and cellular infiltration of the dermis. As I said, most of the times the common prescriptions here is about the Chandamarutha Lepam, externally to be application as an application with the Navanita as a media or the butter as a media in case of lichenification. This is a great combination in case if you can use. Orally, definitely can go with the Kaishwara Gugulu with Gandhaka Rasayana. Blindly in case if it is simple lichenification. External application of Chandamarutha Lepam. In case if the patient needs a more relaxation, once you remove the Chandamarutha Lepam, you can go with Ananda Thailam or Ananda Ghritam locally to be applied on the affected area. As I said already, Ananda Thailam or Ananda Ghritam is a combination of Jasada and Gairika in Thaila or a Ghritha preparations. Pigmentations may be hyperpigmentations or depigmentations. Most of the times, in case if it's very chronic pigmentations, they don't respond to the treatment. And in case if it's a recent onset, yes, definitely. We can try to go with, you have two applications what we usually do. One thing is Shenka, Tankana, all these things are given on local application, as well as Shenka Basma is given orally for using to reduce the severity of these pigmentations. External applications, usually in all these conditions, we have two applications called as a Varnya Lepam and Vasanta Lepam. Varnya Lepam is a combination of Gairika, Gandhaka, Shweta Chandana, Manjishta as a combination, and we give it as an application with either Panchavalkala Kwata or water as the media. And Vasanta Lepam is a combination of pulses, any of the pulses which you are using at home, and to that we mix up a Mukta and Pravala Pishti. Mix all things in the form of a mixture and try to give with an application on the external surface, might be with Dadi as a media or water. It is extensively useful in case of pigmentations. Ulcerations, breakdown of the skin or a vesicle or a pustule. Wash the local area with a Panchavalkala Vata, and you can go with a local application of Jasada or Gairika. And many times we have seen wonderful response in chronicity, even with applications of Tamarabhasma. Or what you can go with a Jatyadi Gritam or Jatyadi Tailam, where you have all this, many of the components in combination can be used for wound nursing. Scarring, many times they don't respond, very chronic. Tamra is one such drug which can be addressed to a certain extent. So very commonly when you have a patient right in front of you, you need to ask him about the distribution of the lesion, whether it comes in crops, any itching or irritation, or any anesthetic patches. Behavior of the lesion in the past, any general symptoms like fever, lymphadenopathy, thickening of the nerve, or complete physical examination, you need to do mandatorily. Common skin conditions which we need to consider when you have a patient with skin lesions: impetigo contagiosa, ringworm or herpes zoster, scabies, pediculosis, urticaria, eczema, contact dermatitis, drug eruptions, acne vulgaris, psoriasis, lichen planus, lupus erythematosus, erythema multiforme, pemphigus, dermatitis herpetiformis, exfoliating dermatitis, erythema nodosum, anaphylactoid purpura, leukoderma, leprosy, rashes of eruptive fevers. These are commonly seen skin clinical conditions in routine clinical practices. The very first one is impetigo contagiosa. Everyone know about this clinical condition, very common in case of kids. It's usually affected in the superficial layer of the skin. It's a macule which quickly changes to a vesicle and pustule. And in this particular condition, usually what happens when you have the patient with this particular clinical conditions, I repeat the clinical parameters of the drugs always. You need to use Gandhaka, you need to use Pravala, you need to use Loha. If it is adamant or if it is chronic, go with Tamra and Haratal preparations. Trifala Gugulu Gandhaka Rasayanam, Thala Sinduram, Rasagarbha Potali or Patola the Kwata Anupanam, Pravala Garbha Potali with Panchavalkala or Panchatikta Kwata Anupanam can be used in these clinical conditions. And after the episode of the illness, need to administer Panchavalkala Kwata for 3 months. Shodhana and Krimihara Chikitsa could be the right choice for these particular patients. The second condition, which is very commonly seen, is about the ringworm, where it is a fungal infection of the skin. In commonly affected area is about the groins, feet, and scalp. In the groins, in the inner side of the thighs, typically you can see the patches, how it is appearing. Macerations of the skin and rounded and bald skin presentation. Everyone know about the lesion. It is like this, the ringworm infestation. Very commonly or very well being addressed with Gandhaka or Karpura applications. Lap of honey and sulfur is also a promising result. So we mix up sulfur along with or Gandhaka along with Madhu and try to use it. And in those clinical conditions, it's an excellent choice. Few of the other prescriptions which can be given in these conditions is Rasakarpuram, Talagarbha Pottali with Panchatikta Kashayam Anupanam, Krumi Kuthara Rasa, Gandhakarpura Lepam. Herpes zoster, inflammation of the posterior root ganglion, which is because of the infection of a chickenpox-like virus, usually associated with severe pain and also vesicle sitting on the erythema. And also you can see burning pain, secondary infections of the vesicles. Trigeminal nerve is commonly affected if it is a facial presentation. Many times this complication results into blindness. Post-herpetic neuralgia is a headache problem in case if it's not being treated properly. And These are the clinical presentations of the herpes. Possibly you take it as in Ayurveda as kaksha, or might be you can take it on the grounds of visarpa depending on how it is being commonly erupted in the patient. And the common prescriptions given here are the Lagusutavati or Kamaduga Muktayukta, Pravala Garbha Kottali with Panchavalkala as an Anupanam, Suta Shekara or Swarna Yukta or Paripata Khada could be given. Long duration of Audumbaravaleha is compulsory because this virus can, in chronicity, cause series of complications, wherein the virus can also accumulate in the patient's body. And it is also been observed in some people, like sometimes it can cause infertility and also been projected in torch panel positive in case of infertile patients. So in all these conditions, it's always better you use Audumbaravaleha for a very chronic period. I do usually recommend if the person is not completed the family life, if it's a pediatric or any of such conditions, we try to give it for 3 to 6 months. The Pravala Yogas are a promising response in these clinical conditions. Dump the patient with 8 to 12 grams of Pravala per month. The scabies is another headache problem, which most of them, especially people who are with unhygienic way of style or especially children, do have. This is basically caused because of a mite and a very fine grayish burrows headed with a pinhead vesicle is being usually observed. It is seen in the private areas and also in the hidden areas like the axilla and all. Intense itching is being observed in the patient and secondary infections are very common like this. So here it's basically a mite, a insect or a worm-like, which makes burrows like this and goes on laying its eggs and multiply. I will say in this areas, in case if you can apply the Chandamarutam or Gandhakalepam, this will suffocate to death instantly in scabies. Excellent response, provided you should not have cuts and wounds. Like the medicine should not enter into the bloodstreams. If it is an external, as you can see here in the picture, it can definitely respond because that itching gets controlled possibly within 2 or 3 days. And you have a great response in the patient. Nimba and Kaidariya yogas are also highly recommended for the local application here. Other prescriptions could be given as Panchatikta Kwatam with Kurmikuthara Rasam, Panchanimba Churnam with Gandhaka Mishranam, Shilagarbha Pottali with Nimbakalka Anupanam, Sthanika Lepam with neem or arsenic or Haratala yogas is being prescribed. Pedunculosis is another clinical condition which is very commonly seen. This is what you commonly call it as a lice. Secondary infections are scratching because of the their lice are visible. You can see here, this is very common condition which is seen in most of the people, especially in school going age, where they commonly use a common bed or they use a common comb or any of the hair products used by somebody else who are been already infested with this particular conditions. And here common prescriptions are Triphala Kwata Prakshalana, Tankana Jala Prakshalana, Nimba Taila Shiro Abhyanga or Pichu, Porlai Triphala Gulugandhaka Rasayan. So most of these patients, normally what we do is Tankana Jala, we go for even Shirodhara in these conditions because it's a sort of a kshara and all these lice will die away in Tankana Jala. Urticaria is another headache which is very commonly seen in patients' conditions. Hypersensitivity to certain foods or drugs, typical lesions, extremely itchy, may be associated with swelling, subcutaneous, sometimes it goes to angioneurotic edema, like this. Patient has severity. Common prescriptions and promising drug is about the Shitam Shurasa with Haridra Kanda as an Anupanam, Triphala Gugulu Gandhaka Rasayanam, Lagusutavati, Arogyavardhini, Loha Garbha Pottali with Asanadi Kwata Anupanam, or few of the great choices which is commonly given in Shitapitta or commonly given in urticaria. Castor oil with lemon, mix it together and it can be used as abhyangam or local application on the whole of the body in case of urticaria. Is also a great choice. Eczema, every one of us know about it. It's inflammation of the epidermal caused by the atrophy or hypersensitivity, and many times this is not known why it happens. But basically, it's having 3 stages of eczema. The first one is about the acute stage, which is a minute epidermal vesicle which readily breaks and exudes serum. Weeping eczema, what we call it as. And subacute stages, exfoliation of a horny layer of the epidermis and vasodilatation and moist appearance. Chronic stages where you have the skin develops the abnormal horny layer with scaling, cracking and thickening of the skin and much itching results in lichenification. This is acute stage, as you can see here and here. And this is a very chronic stage. Common prescriptions, Kaishara Gugulu Arogyavardhini, Gandhaka Rasayana, Tamra Garbha Potali, Loha Garbha Potali, Panchatikta Kashayam and Talakeshwara Rasa. Chandamaruta Lepam can be used on the external application. Panchakarmopachara can be adopted depending on what is the clinical presentation of the patient and if at all is fit for Panchakarma. This is Ananda Taila, how it is being used. Contact dermatitis, where you have the hypersensitivity, eczematous reactions. As you can see, the treatment is similar to that of eczema. Only thing in contact dermatitis is we try to go with a Vishagna Dravyas like Tamra, Swarnamakshika, Swarna, or the very good Vishagna Dravyas in Rasaushadhi, which can be used in hypersensitivity or dermatitis. Kaishwara Gugulu, Arogyavardhini, Rasamanikya, Pravala Garbhapotali with Shirisha Rishta as an Anupanam, Hema Garbhapotali with Panchatikta Anupanam, Lagusutavati, Kamaduga, or the choices which can also be used here. Drug eruptions or dermatitis medicamentosa, where you can see which it resembles just like a lesion very commonly in many of the disorders. So here, the very first thing is you have to withdraw the drug. Along with that, you need to dump the patient with lots of Gandhaka and Gairika preparations. Try to see that you palliate or minimize it. Usually we give Shirisha Rishta as an Anupana because it is Vishagna. Similarly, Tamra or Swarna preparations can be given here in drug eruptions to minimize this dermatitis medicamentosa. The prescriptions based on the clinical presentation, like burning sensation and all, Kamaduga is given, Gandhaka Rasayana, Loha Garbha and Pravala Garbha, Pravala Yukta Gulkan is being given, Audumbara Valeha is prescribed. Shirisha Rishta with Hema Garbha Potali is a great choice and symptomatic treatment can definitely be adopted. Withdraw the drug where the patient is having allergic to is the first line of management. Acne vulgaris, very commonly seen in young adolescent people. And everyone knows about it very well, where it happens, what is that comedos, which is happening there. And like this, you can see the stages of acne vulgaris. Common prescriptions, Kaishwara Gugulu with Arogyavardhini, Lagusutavati, Loha Garbha Potali, Tamra Garbha Potali, Khadira Sara as an Anupanam, Vasanta Lepam, Varnya Lepam, or what you call it as an Ananda Lepam or Panchavalkala Prakshalana is a great choice. Aloe vera is also being used along with Jasada Basma for the local application, gives a tremendous response. Psoriasis, typical lesions as patchy, where you have the Cobnus phenomena positive, candle grease test positive, autoimmune pathology, you need to address the patient's condition, sometimes associated with polyarthritis, what you call it as psoriatic arthritis. It's an autoimmune condition. We are going into the deeper part or the chronicity of the illnesses, deep-rooted illnesses of the skin pathologies here. So Hema Garbha Potali is a right drug to be added here. For the pain management, if it is psoriatic arthritis, Mrutyunjay Rasa along with Punarnavadi Mandura Arogyavardhini is a choice. For the skin pathologies, you can give Panchatikta Gugulu with Tala Garbha Potali, Loha Garbha Potali, Pravala Garbha, Hema Garbha, Asanadikwata, Ananda Taila or the Grita, or Chandamartham for the external applications. Lichen planus is a typical lesion, small flat-topped polygonal papule or a violet color. Exposed part usually are being affected, widespread all over the body, and they don't respond that easily to the drugs very commonly. And aloe vera is one great choice where you can use in this condition for the external application. Other prescriptions could be something like Hema Garbha Potali, Pravala Garbha, Loha Garbha, Kumaryasava Kwata, Panchavalkala Kwata, Nimbadi Churna, and Chandamartha Lepam are the choices which can be used here. Lupus erythematosus, one of the worst skin condition ever seen in the patients suffering, because balancing these clinical conditions is with lupus erythematosus is many times a hell of a job, because it goes into the systemic complications. Multiple systemic approaches are very much needed. Clinically, the patient presents with typically a butterfly arrangement on the face, area of the purplish red or raised and slightly indurated, SLE or systemic lupus erythematosus, where you have complications with a nephrotic syndrome, pericarditis, endocarditis, splenomegaly, hepatomegaly, jaundice, any of these things. White cells, where you have lots of complaints seen in peripheral blood smears. You can see this butterfly-like spot here. Common drugs or combinations which we can give in case of SLE positive patients with or hemagarbha is mandatory. Don't ever take a choice. It is an expensive drug. Let us see after a few days. Don't take the choice because the patient conditions might go out of reach. Try to prescribe the hemagarbha to the patient Jaimangala Rasa, Mrutyunjaya Rasa, Tridhatu Garbha Potali, Kumaryasava, Rasamanikya, Thala Sindura. Vasanta and Varnalepam or Anandalepam, any of the applications can be given externally. Erythema multiforme is another clinical pathology. Many times the patient or consultant might take it as a hypovolemic or any of such complicated stages with slight fever or post-fever attacks. You can see these clinical conditions. The best part of the treatment is Pittahara Chikitsa. I know it is against the rules of Ayurveda, but still I do ask the patient with erythema multiforme to uncloth himself and sleep on the coldest floor like a marble flooring in an AC room. I could appreciate a very tremendous response in these patients. I know it's against the dosha dhatu siddhanta, but I need to control the patient as early as possible. You need to do all Shitala Chikitsa here in erythema multiforme. Dump the patient with lots of mukta pravala preparations. And here is how the patient comes to control. Aloe vera as a lepam along with varnya is also a great choice here. Shitala Chikitsa with pearls and corals is also a great choice. Pravala Garbha, Panchavalkala Kwata, Trifala Gulu, Pravala with Gulkan, Kamaduga. Shitala Chikitsa is a mandate. Pemphigus is another headache problem with skin pathologies. Great issues, very serious, patient might even collapse. No choices. You need to definitely see because whatever you give, the patient will have a reaction. Every day, the patient comes with a new lesion. Bulle appearance surrounding with erythema, bulle all over the mucous membrane. They appear in crops and also severe, it associates with fevers like this. Very complicated. And Hemagarbha Potali with Dashamula Anupanam is a mandated drug here. Panchatikta Gugulu is also a choice. Sarveshwara Parpati is also compulsory. You have to use Sarveshwara Parpati here. Lohagarbha Potali and Triloka Chintamani Rasa to avoid the multiple systemic failure. It's very much needed. Dermatitis herpetiformis with a bullous erythema, urticaria, severe itching, and mucous membranes are not involved here and chronic in the chronicity or courses of it. We can give Sarveshwara Parpati similar to the prescriptions of herpes zoster. Exfoliative dermatitis, where you have the peeling of the skin like this. We can go with Arogyavardhini, Asanadigrita, Ananda Tailam, Lagusutavati like preparations. This is Ananda Tailam, what you can see here in the picture. Erythema nodosum, again, red and tender erythema nodosum is really bad, very bad in treatment, doesn't respond easily. It is associated with streptococcal infections, primary tuberculosis, sarcoidosis, systemic fungus infections, ulcerative colitis, regional ileitis, and many complications many times like this. Lohagarbha, Varunadikwata, Manjishtadi Taila, Sinduram, or Lagusutavati, Panchatikta Gugulugruta, Varnalepam could be the choices. Nodular liquefying paniculitis, this is associated with necrosis. The same lesions, but this is associated with necrosis. As you can see here, it is necrotic changes. Here, we need to change our prescriptions to Sarveshwara Parpati, Hemagarbha, Ekrutu Plihari Luhan, Punarnavadi Manduru. The next extension of this is the Burgess disease, where you have thromboangiitis obliterans in associated. So here you find skin lesions being present here. And in these conditions, we give Kaishwara Gugulu, Dashamula Katutrayadi, Vimala Basma, Vaikranta Basma, external application of Eranda Thailand, Tamragarbha Putali. Anaphylactoid purpura, purpuritic spots all over the body. It could be because of allergic manifestation or intestinal colic or bleeding per rectum. You need to assess the bleeding time like this, as you can see here in this particular patient. The common prescriptions which we usually give are the mercurial preparations. Like you have the Rasakarpura, Hingulia Manikarasa, Manjishtadi Talasinduram, Ikrutuplihari Loha, Hemagarba Potali, Loha Garba Potali, or could be the choices. Leukoderma, very commonly known to us, like these are the cases with leukoderma. Tamragarba, Haratala, Manashila Yogas, Bakochilepa, Jayapala, Tankana, Shashilekhavati, Udayaditya Rasa, Shutrahara Lepam. Leprosy, of course, not seen nowadays, very, very minimum, or it has been taken up by the government approved doctors for the leprosy being caused by the leprae bacilli. As you can see here with the complicated stages, not a treatable condition as per law. Rashes of the eruptive fevers like measles, chickenpox, or smallpox, you need to address the actual disease first and try to treat. Basic thing is yukti in our treatment is mandate. Don't go on the name of the disease, go on the basis of doshas and dhatus and try to see how best we can address these clinical pathologies of skin lesions and see our patients back with a smile on the face, stating that thank you for giving this particular beautiful skin back to me, which I was not expecting to. So thank you very much for all the organizers for giving me. I'm very sorry to run up the slides because it's a very, very, very big chapter. I can take the dermatology alone for at least 10 to 12 hours. Because here I have in my website, I've taken almost 20 hours on dermatology. I need to see, I felt so something like I should take some topics of it and leave it away some other topics. Then I find it is doing something like injustice to a particular set of disorders. Then I thought, okay, let me run up this because however you have the recordings available, you can hear it in case if you would like to wish to listen to it for the second time as well. In case if you want more prescriptions, we are always there here to reach out and we can definitely help you out what best we can. Thank you very much.
Thank you.
Thank you so much, sir. It was raining wisdom from you. And although in a short time you covered a lot of, exhaustive coverage. So now let us take some questions from the audience, sir. So,
Yeah.
sir, there is a question of from our audience that how about treating insulin resistance, like those who have those what you say, nigricans.
Yeah. See, normally it usually happens like you need to address the patient with oral anti-diabetic medicines. I'll say the patient is not responding. The patient is already taking some insulin-like prescriptions. I'll say add on to that with the drugs related to what we usually give in Ayurveda. For me, it is Chandraprabha, Arogyavardhini, and Asanadikwata, which is very commonly given in case of patients suffering with moderate diabetes. Again, to go with it, you have extensive protocol. That's a different issue. But this is a basic outline like what we try to give. Giving this orally, external, we give the application of Vasanta Lepa and Varna Lepa. Presently, I have a patient of the similar thing, what you are trying to explain me, like it's where insulin resistant and the patient is absolutely not responding. Instead, it's a complication in case if the patient is having diabetes along with the thyroid dysfunction and nigricans, where you have, because even in thyroid dysfunction, you have the same thing being precipitated. The tanning-like appearance on the whole body is also seen in thyroid dysfunctions on skin pathologies. So in all these conditions, I will say we need to give the local applications along with systemic. Periodic Shodhan has also been recommended. I am a person from Rasa department, so Panchakarma is not my first choice. It is second choice to me. The first choice is Arogyavardhini. I try to give to the patient with 2 TDS or 3 TDS of Arogyavardhini, have some 3 to 5 Vegas per day, and try to see the patient is wonderfully responded.
Okay. So then one more question is like there are some chronic non-responsive acne, which is a challenge for you give everything, Arogyavardhini, Trifla Gugul, Keshor Gugul, everything is done. And even in females as well as in men, like even if we consider their menstrual cycle and all these things, then how do we handle that?
Yeah. Basic thing in case if it is acne, primarily at an outset, at least in Indian consistency, we usually take three criteria. The very first and very common thing is the local skin affected areas like because of dandruff. Normally, what happens, we just check with the skin levels and try to go with treating the patient with acne. This is not right. We should address the dandruff first. Because if the dandruff has been warded off many times, acne will disappear most of the time. I do ask a patient to go with the Tankana Jala Prakshalana. We try to go with the Gandhakalepa on the scalp. We try to go with addressing with the patient, taking with Shirodhara with the Triphala Kvata. Try to see that dandruff is minimized, or you can try to address the condition as early as possible. This is the first thing. The second clinical condition is about the hormonal variations, which is very commonly seen, very specifically in female. Especially during the periods, they do have nearing to the periods, they do have this, and once they happen to come across with their menstrual cycle, the acne will come down. So this is being observed. So it is a gross guidelines to say that possibly it is related to a hormonal imbalance. This is because of the pitta prakopa, which is active because of that metabolism, which is supposed to happen during a normal menstrual cycle. This happens even in the male. But what the thing is, it's only a metabolic alteration. It's not because of some other complaints. Only in these conditions where you're very sure, like it is a metabolic alterations, which is commonly seen. I don't have dandruff in the patient. I don't have any other reasons. Then the prescription could be Kaishora Gugulu with a Gandhaka Rasayan. In case if you have the skin lesions where it doesn't have a pustule with it, it's only a sort of a pimple like and it goes away. It's a simple macule or a papule. Like clinical presentation, this is enough. But in case some people in chronicity, they do develop vesicles. You have a pus discharge. And this is because many times because of the secondary infection. You should ask the patient not to touch his face or the affected area because it's a cross infection. Ask the patient to frequently apply Gairika with Panchavalkala as a media. This is an excellent response. Once you don't have much of the eruptions, we ask the patient to go with using Gairika as a scrub. This is a great choice. The media is Panchavalkala Kvata. Don't take some kashayams from the market because they add some preservatives and all. Instead, it's better you prepare the Kvata by yourself, mix it with Gairika, and give a sort of a scrub-like appearance to the patient. In case if it's a sensitive skin, let them apply it and leave it. Let them not scrub over it. But in case we find some hard patches on because of the chronic acne, then we try to go with using Gairika as a scrub. You find lots of ulcerations on the face in acne complications where you have patient with lots of pustules and ulcerations also because of secondary infections or whatever the reasons are. So to Gairika, we add Jasada. So you have Gairika, Jasada and Panchavalkala Kvata, use it as a lepa. Then also the patient will have an excellent response. The same combination can be given orally also. Ask a patient to take it orally and also for the external application. Orally, we are adding Kaishora Gugula and Gandhaka Rasayan. That's all. You don't need much to worry in case if it's a metabolic derail or secondary infections of the acne. And ask a patient not to touch or immediately remove his excess nails because the secondary infections gives a permanent scar mark. They never go. Even though today you find it has been faded away significantly, once they cross around 40, 45 years, these scar marks will get highlighted because the elasticity of the skin is reduced. Then these small scar marks are being highlighted later on. So better you should ask the patient not to use his fingers or nails to rub them. Very commonly seen in adolescents.
Okay. Sir, there is a question. How about melasma? It is very difficult to treat melasma in women.
No, Vasantalepa and Varnalepa is really good. I say you need to use this. Melasma I have seen in so many patients has been disappeared.
Thank you, sir.
Yeah, you can just go with external application and ask the patient to go for even the Ananda Thailam like preparations as overnight applications. Because during the daytime, they will not apply. But one thing, if at all you are giving any of the Thaila preparations to the patient suffering from melasma, you might have some of their surrounding people addressing after your application with this Thaila or any of the Ayurvedic preparations which we are giving in respect to the Thaila base, they usually turn dark complexion.
Okay.
That is not because of the drug. It is because that oil is not totally removed from the skin by using any of the mild soaps or any of the powders which we usually ask them to take for the bath. So the thyla stays on the skin and you have the dust to come and settle on that particular area and people look as if they are being tanned. So it's not a harassing issue. You can ask the patient to discontinue with the thyla preparations for the external application. Within a week's time, patient will get back his skin luster. That's absolutely not an issue.
Great, sir. So one last question. How about patients those who have relapse of fungal infections? Like they respond very well with Ayurveda treatment, but again there is a relapse. So how do we handle that?
No, once a patient is being treated with the drug combinations for the fungal infection, any of the tinea conditions, I will say the local area which has been affected, you need to wash that area for a longer duration with a tankana jala or panchavalkala kvata so that that area has been totally cleansed, and always keep that area dry, aerated and dry, because normally they are the private parts or whichever is being closed areas like the axilla and all. So in all those areas, we ask them to wash with the panchavalkala kvata or tankana jala or aerate these parts frequently. You need a good aeration in this particular areas. And also local application of honey is a great choice. Honey with jasada is a great choice for all sorts of fungal complaints.
Namaste,
Okay.
sir. Sir, can you just tell the procedure about Tankan Jal? And one more question. In Darunak, whether Tankan Jal is Upyukta or Tankan Lahi is Upyukta, sir? There's a
Tankana
difference.
jala. Tankana jala is being used. So here normally what we do is for every 1 liter of regular plain water, we add 10 grams of tankana. It is called as a tankana jala.
Sir, and one more question. In kids nowadays, what we are seeing in the arms on the lateral area, there are small boils. Kids don't have dandruff or something, or sometimes there is back acne unknown. What may be the reason, and could you please guide us on the treatment for the same? Thank you.
You need to address, because normally in case if it is an infant, so here what happens is that area is not been exposed for aeration. It has been just kept on the damp area, or it is over a soft bed or something where that area is not been properly been aerated and the sweat gets accumulated. And because of that, the child will have all these issues. Normally what we are asking for these kids is morning bath with regular coconut oil or Nalpamaradhi Thailam in the morning, and try to use. We are having this Ananda Thailam where we add sandalwood to extensive way, means it is more of Chandana Thailam, and try to use for Abhyangam in the morning, and throughout the day keep that area aerated and dry. Orally, what we are doing is, in case if the child is able to take orally, then Gandhaka along with Manjishta is being given. In case if the child is too infant and not able to take, we give the prescription to the mother. In case if it is given to the mother, because through the lactation, the medicine comes to the child. So there we give Gandhaka along with Panchavalkala, or Gandhaka along with Nimba, Panchavalkala with Panchatikta. So any of these combinations, but Gandhaka is mandate. You need to give Gandhaka.
Thank you.
Okay, so one last question now, because we really wish that we get a lot of knowledge from you, but due to time constraints. So there is a question: if a patient is allergic to sulfa, then how do we handle this Gandhak Rasayan in those patients?
Sir has already told this.
Okay. No, your voice was interrupted. Possibly the
Yeah.
question was, if the patient is allergic to sulfur or sulfur drugs, how can we prescribe Gandhaka preparations? Right?
Yes, sir. Yes, sir.
Okay. So in these, yeah, I have seen in so many patients, even the person who was allergic to sulfur drug doesn't have an allergy with Gandhaka. You can definitely
Right.
give it to the patient, because we do Shodhana. We
Right,
do
sir.
Gandhaka Shodhana in a proper way and try to give. If you can prepare it by yourself and give it to your patient, it's a great choice, because many of the pharmaceutical companies, they might not do a proper Shodhana. Then it becomes a
Right.
problem to the patient. Just giving the
Right.
sulfur from the mineralogy department and dump it into the patient's body. I do a procedure called Shodhana. Then after that, I prepare it. Might be in the name of Gandhaka Rasayana. You have so many bhavanas. Very combination of Gandhaka has been not having any of the allergic. I haven't seen, possibly I have given Gandhaka Rasayana to more than 1 lakh patients in the past 20 years. I haven't seen any patient having any reactions with Gandhaka till date. Absolutely no. But still, if you find, you can give any of the
Surjit, move on to Ruchira.
Yes.
to the patient, wherein you
Right.
can definitely ask your patient to go with Isha.
So great, sir. We wish
Okay.
this just goes on and
Ma'am,
it
I
doesn't
just wanted
stop.
to add here. Ma'am, I just wanted to add
Now,
here.
last,
Final
I
question.
would like
Just
to
final question to Gopi sir. That sir, what is the oral administration in the local application for the keloid, and any experience and how much time it took if we are treating keloid-like conditions?
They're not very comfortable deep root. Don't go for any irritating substance, because I have seen some people going for some Kshara preparations and everything applying on the affected area. No irritations. Instead, just coconut oil or some mild things which can make it more softer. That's enough. Oral medications normally here is the Haratala preparations and Gandhaka preparations. Orally given. If it is a superficial keloid, it vanishes. But in case if it's a deep-rooted keloids, they don't respond to the treatment.
gratitude,
Sir,
sir.
I have a
Now, I
small.
now invite Dr. Ruchira Barlota to tell us more about our future activities of NIMA Dermatology Society. Dr. Ruchira Barlota, madam, please take over.
Thank you, Dr.
Ma'am,
Sujit, ma'am. We are delighted and educated by today's interesting lecture that has been delivered by the special guest of today's program. Thank you, Dr. Gopi Krishna, sir, for valuable insights that have been provided by you through this event on NIMA Dermatology Society platform. If any of members attending today's lecture have queries regarding today's topic, they are welcome to post their queries on our YouTube channel. Now, moving ahead, I'm glad to inform that NIMA Dermatology Society will be conducting few activities in coming months. Next competition will be conducted next month, that is from 15th Feb to 15th March. Subject of competition is recipe for healthy skin and hair as per Ayurveda principles. Rules and regulations are: participants should explain the recipe preparation with its importance in skin and hair. Video length should be maximum of only 2 minutes. Participant must record the video and send to our email ID of NIMA Dermatology Society. Eligibility is BMS, UG and PG students and practitioners. Next activity. Next webinar will be held in the month of March by respected Dr. Lakshmikant Patil sir. He is professor of Dravyaguna subject. Topic will be important drugs and formulations in dermatology practice. Next exciting and most awaited international seminar on dermatology will be soon conducted by NIMA Dermatology Society. To get more details, follow our NIMA page on Facebook and Instagram. Stay tuned to know more details. Thank you.
So there is one more thing. I got some query about how to join the NIMA Dermatology Society. In the beginning itself, I just told in detail, NIMA Dermatology Society is inviting the doctors who completed the online offline courses in dermatology, cosmetology, as well as aesthetic medicines. Then if the member is NIMA member, so he has to pay 5,000 rupees as a lifetime membership fees, and non-NIMA member, they have to pay 7,000 rupees. And you can contact any of our NIMA members for joining the NIMA Dermatology Society. Thank you. Move ahead.
I now request Dr. Arvind Bagdare sir to give his vote of thanks.
Thank you, ma'am. Good evening to our honorable guest speaker, NIMA CC members, NIMA state members, our NIMA Dermatology Society committee members, all doctors, students, and everyone gathered here. As William Arthur Watt, a motivational writer, once said, feeling gratitude and not expressing it, it's just like a wrapping a present and not giving it. It's my privilege to propose a vote of thanks and acknowledge the contribution of those who work really hard to make today's session. I, Dr. Arvind Badgare, Secretary, NIMA Dermatology Society, on behalf of NIMA Dermatology Society, extend my sincere thanks to the Almighty for making today's webinar success. On behalf of our NIMA Dermatology Society, I extend a heartily vote of thanks to our guest speaker, respected Dr. Gopi Krishna sir, who spared time from his busy schedule to upgrade our knowledge. Sir, your informative lectures have enlightened our mind and have shown us a new path. Today, we got a lot of information which will truly help us in our dermatology practice. I take this opportunity to specially express my deep regard and gratitude to the NIMA CC President Dr. Ashutosh Kulkarni sir for always encouraging us and providing opportunities to organize such informative sessions of webinars. I would especially thank our beloved President of NIMA Dermatology Society, Dr. Shivananda Patil sir, for his dynamic support and confidence in us. My deep sense of appreciation and thanks to all the participant students who choose to be live with us and attended the webinar with great enthusiasm and made it a successful event. My sincere gratitude also goes to the organizing committee for taking topics that really matters in our day-to-day practice life and update our knowledge. Last but surely not the least, I thank our technical team for all the technical supports and for helping us webcast our webinars. My sincere apology if I have missed out on somebody. Thank you again to all assembled here and being with us this evening. Thank you. Thank you very much.
Thank you very much.
Thank you, Dr. Arvind Bagdare sir. Now, let us leave on the note to meet again in large numbers for the next knowledge session by the NIMA Dermatology Society. Thank you, one, and thank you all.
Thank you.
Thank you, sir.
Thank you,
Thank you.
Gopi Krishna sir. Thank you very much.